Sarosy from SD Body Contouring in La Mesa, California. I'd like to go over a popular subject today, buttocks enhancement. I think there's a lot of confusion out there about the options for buttocks enhancement. I'd like to just clarify some of that stuff today. So as you know, buttocks enhancements become a very popular topic, almost as popular as breast augmentation, but we have some different options with buttocks augmentation that we necessarily don't have with breast enhancement. One of the most popular procedures that we do today is called a Brazilian butt lift, which in reality isn't a butt lift at all, but is just a fat transfer to the gluteal area and works well in giving the buttocks a more round contour as well as larger contour, but oftentimes does not meet the expectations of the patient because of all the media hype of large buttocks that's out there. A lot of these celebrities and stuff have buttocks implants versus fat in their butt, and I just like to clarify some of that today. So I think one of the first things to do is go over the implants. The implants for a gluteal augmentation is totally different than a breast enhancement. A buttocks implant is a solid silicone implant, as you can see, that even if it's cut or ruptured, stays together. One of the disadvantages of the buttocks implants are they're somewhat difficult to place because they are solid. They're not as mobile as the implants for breast enhancement, which was a gel implant, which is a lot softer and more forgiving in putting in. So you're allowed to go a lot bigger with an implant in the breast than you are really with a buttocks augmentation. One of the other big differences between the procedure besides the implants is the recovery time. Recovery time with a buttocks augmentation can be substantial. You need to really be off your buttocks for a good 3 to 6 weeks depending on your site of incision and how you're healing. And that's one of the downsides that of buttocks augmentation that you don't necessarily see with fat transfer. Fat transfer is a totally different procedure. Fat transfer is a procedure where we do liposuction on other areas of the body. So one of the advantages of that is the areas that are liposuction are going to be much flatter, more contoured. Then we take that fat and process it, separate the fat from the fluid, and then re-inject the fat. And one of the nice advantages of the fat transfer is we can put the fat wherever the patient desires and certainly make recommendations. But one of the negative things is it is a free graft, and the fat, certainly all of it doesn't take. We end up putting a lot more fat than we need because we know we're going to lose a good portion, up to 50-60% of that fat. What I found is you need up to 1 liter per side to get a good result, and one of the limitations is that a lot of patients don't have that much fat to do a transfer. So if you have someone who's athletic build, then they may be a better candidate for a buttocks augmentation versus a fat transfer. You can also do fat transfer in someone who's had a buttocks augmentation. The other advantage of a buttock augmentation with an implant is it's going to last forever, and the results, I think, in some respect are going to be more dramatic and more what a patient desires. So yeah, it's a big commitment to go through a buttocks augmentation, but it may get you a more desired result than a fat transfer. So I like now to just show some before and afters and maybe show you the difference. I'm going to show you the buttocks implant first. You can see this patient's a very athletic female who doesn't really have enough fat to do a fat transfer. But with a very, very small implant, you can see the dramatic increase in her buttock size. This is a 250 cc implant, and again, somewhat limited in how big an implant you can put because her athletic build, it's nowhere near what you can do with a breast implant. But you can see a very dramatic result early on with just an implant. Unlike a fat transfer, which is over here, although her buttocks looks markedly better, it has a more round contour. It does look slightly bigger, taking away the fat from her hips. As you can see, it gave her an overall better contour. But really, from an augmentation standpoint, her buttocks doesn't look all that much bigger. It certainly does have better shape. So I just hope that this clarified some of the difference between a fat transfer to the buttocks and a buttocks implant placement. And if you have any further questions, you can contact us at SD Body Contouring. Thank you.